Hello, my name is Katie Thompson, and this is case study number 1 for David. David's background. David is a 67-year-old living in North Dakota with his wife and dog. He is overweight with a BMI of 29. David is not physically active. David has had 2 melanoma skin cancer moles removed from his forehead and cheek when he was in his 40s. David has also had colon cancer when he was 64. He had the tumor removed and was treated with radiation. David's wife was diagnosed with diabetes 5 years ago, so she and David have been eating less meat and cheese and consuming more fruits and vegetables. David's 24-hour food recall. For breakfast, he had white toast with butter and grape jelly, pre-made oatmeal with cinnamon and apples, and coffee without any cream or sugar. For lunch, David had a Caesar salad with chicken and croutons, a small bag of barbecue chips, and a Diet Sprite. For dinner, he and his wife had spaghetti with tomato sauce and added zucchini. He also had a large piece of garlic bread. Later that night, he had a piece of chocolate cake with a glass of water. Additional information about David. David's wife encourages him to take a multivitamin, but he rarely does. Since retiring from work 5 years ago, he often stays inside most of the day watching his favorite TV shows and tinkering in the basement. David usually complains of lower back pain and fatigue. Some days, he has all over body aches that keeps him on the couch all day long. His wife has convinced him to see a doctor. Doctor's observations. The doctor noted that David has high blood pressure. She also notices David is pale in color and walked as if he had sore joints. The doctor issued a bone density scan and a blood test for David. She also suggested a multivitamin until the results from the scan and blood test were known. Questions. After reviewing David's background, sample menu, conditions, and doctor's observations, what vitamin do you think David has a deficiency in? What factors in his life could contribute to his conditions and/or past diagnosis? Do you recommend vitamin supplementation, a change in diet, or a change in lifestyle? Or perhaps a combination? If left untreated, what other conditions might David develop?